Your brain is your body's control center, shaping how you think, feel, and move. When something goes wrong, it can affect everything. Welcome to Your Brain, Your Health, a podcast from St. Luke's Neurosciences. We'll explore conditions that impact the brain, spine, and nervous system, and how they connect to your overall well-being so you can stay informed and take charge of your health. Thank you for joining us for today's episode, Understanding Sleep Apnea and the New Wave of Inspire Therapy. We're your hosts. I'm Dr. Eric Eustace, emergency medicine physician at St. Luke's University Health Network.
And I'm Dr. Daniel Ackerman. I'm section chief for the Department of Neurology and director of stroke and vascular neurology here at St. Luke's. And we have with us today Gautam Narla, who is a sleep medicine specialist at St. Luke's. Gautam, thank you so much for joining us.
Thanks, guys. Happy to be here.
Now, some of our listeners and viewers will remember that we talked about the 4 pillars of brain health before, and sleep is one of them, which is interesting as doctors because we do such a good job of making sure we get adequate rest all the time. Before we get into treatments, new technology, let's start with the basics about sleep apnea in particular. So when people talk about sleep apnea, what's actually happening?
So sleep apnea is when your airway gets blocked off while you're sleeping. So basically you go to sleep and then your tongue falls backwards and blocks off your airway in your velopharynx, and then basically you stop breathing. Usually it's people's partners that tell them, hey, you're snoring, you stop breathing, and you're like gasping for air. And generally when you're not breathing when you're sleeping, that means you're not going to be well rested when you wake up in the morning.
So your body is trying to breathe,
Right.
but the inflow and outflow is kind of blocked off.
Right. And a lot of people, they'll sleep through it. They don't know that they have sleep apnea, but they'll wake up feeling tired, they're dragging all day. They have brain fog, that kind of thing.
Yeah, that's actually a really great point. I've had a lot of patients that I've spoken to about sleep apnea tell me, but I sleep through the night.
Right.
But when this happens, it doesn't wake people up enough to be aware of it?
Sometimes it does. Some people sleep through it. But when you have sleep apnea, you're always in a light stage of sleep because your brain will kind of keep you in a light stage so that you wake up, basically.
So it's not just about quantity. This is really impacting our quality of sleep.
Right.
All right. Now, if we don't treat sleep apnea, so let's start with the scary stuff, right?
Yeah.
If we don't treat sleep apnea, what happens?
So whenever you have sleep apnea, you stop breathing, your oxygen levels drop, your heart rate and your blood pressure go up. So imagine every night when you're sleeping, your heart should be resting as well. But instead, it's kind of going haywire. So that puts a lot of strain on your heart, leads to an early heart attack, stroke, arrhythmias like AFib, that kind of thing.
Okay.
That's the stuff I deal with on a daily basis.
I'm sorry, he said stroke, you know.
I'm sorry, I'm stealing your thunder, Dan.
I'm just saying. Although it's really interesting to me how often someone will come in with a stroke or a heart attack or something more simple, high blood pressure, daytime exhaustion, just even an inability to do what they want to be doing from day to day. And we start to have a conversation about sleep apnea, and it's sort of the window through which we realize someone's got this going on. So sometimes it's people are snoring or gasping. Other times, though, it can be some of these more serious medical challenges.
Well, I was going to ask, so when would we be worried about some of the signs or symptoms? Because I think most people, day and age, they have bad nights of sleep, right? They might feel tired in the morning. Yeah. A lot of people snore. How do I realize and know when to actually go get checked out for sleep apnea?
So if you're snoring, that's a good reason to get checked out. If you're snoring and you're tired during the day, even things like if you're irritable, if you're depressed, if you feel like your memory's off, your concentration's off, that's all good signs that you might have sleep apnea. So it's always like anything, like a colonoscopy, it's good to get screened for these kind of things. So getting tested is a good idea.
Usually, I think also if you're worried about some of those risk factors, I find it's helpful if you ask their spouse or someone who most people don't seem to admit to it on their own. And then someone says, no, come on, look, you snore and you fall asleep in front of the computer. And remember, we were driving last week and you fell asleep at that red light. And
Right. It's usually the spouse that forces the patient to come in. And then that it's mainly snoring that bothers the partner, and that's the kind of thing that I see a lot.
So if somebody comes to you and says, I'm concerned about sleep apnea, what do you do? Like, how do you evaluate that?
First step would be to get a sleep study.
Okay.
There's a home sleep study, and then there's this sleep study in the lab. The main difference is that the home study, you basically take the equipment home, you wear it at night, and then drop it off in the morning like a library book. The in-lab study is there's going to be a little bit more equipment. There's going to be EEG, so we can look at your brain activity, see how much you're sleeping, see what stages of sleep you're getting, how much REM, that kind of thing.
And so EEG, so we're back in my world again, right? But EEG, so, when people are sleeping as part of a sleep study, with an EEG on, so that's just little stickers on the head, right? And then in the lab, I know there'll be some stickers on the chest and an oxygen monitor and a breathing monitor. At home, it's pretty similar, right? It's an oxygen monitor on the finger, a breathing monitor, and it's just some loose
just a belt on your chest
that go around to listen to your breathing. Okay, so it's not. It may not be the absolute greatest night of sleep you ever get, but most people do sleep enough that we get a sense of it, right?
Right. And all we really need is 2 hours to be able to diagnose sleep apnea.
Oh, okay.
Ooh, that's fast.
That is fast.
Not bad. What kinds of people are actually at risk for sleep apnea? I mean, there's some classic things you hear about in the media, but I see so many different patients that turn out to have sleep apnea, and some of the time I'm really surprised.
There's this concept that usually if you're overweight, then you're more at risk for sleep apnea, but that's not the truth. You can be thin and have sleep apnea. A lot of it's the way your anatomy is. It's partly genetic. But yeah, generally when you gain weight, it puts you more at risk for sleep apnea. And then if you're a male, generally you are at higher risk for sleep apnea. If you have high blood pressure, if you're snoring, that's a good indicator. And generally if you're tired during the day.
Okay, so some of it are risk factors. There's some signs and symptoms we look for, but things that are like pretty common for what we deal with from day to day. Now, I know we're going to talk about CPAP and we're going to talk about Inspire and some of these different therapies, which are super important. But what about lifestyle? What about I change my diet, I lose weight, I get tonsil surgery? I don't know. Are there other things people can do to prevent it or to help treat it if they do have it?
So for kids, actually, the treatment for sleep apnea is just taking out their tonsils and their adenoids, and that usually does the trick. For adults, CPAP is obviously the one that everyone knows. There's also an oral appliance that it pushes your jaw forward so that it opens up the airway. There's Inspire, which we'll talk about more. Lifestyle-wise, losing weight generally helps with sleep apnea. Something like 70% of people, if they lose weight, they don't have sleep apnea anymore.
And what about lifestyle things like alcohol or sedatives in particular for people who are, they're waking up tired, they might take medicine to try and help them sleep or things like that. Do they have an impact one way or another? Yeah,
so alcohol actually doubles the amount of times that you stop breathing at night if you have sleep apnea. Some of my patients like to have a few drinks, and I always tell them that's the night even more so you should use your CPAP, or else you're going to wake up with a vicious hangover. Because it's the sleep apnea and the alcohol that's going to affect you.
I've heard a lot about Inspire, and is this a meditation app or what is Inspire? I'm very confused. So
Inspire,
let's meditate the sleep apnea out of us, right? No, I'm very curious, and I think our listeners are too, kind of what Inspire is and how it can help in patients.
Yeah, so Inspire, it's a hypoglossal nerve stimulator. So basically, it's when you have sleep apnea, your tongue falls backwards into your airway and blocks off the airway. So what Inspire does, it basically stimulates your tongue to move forward while you're sleeping. It's nothing crazy. It's not like your tongue is going to stick out of your mouth, but it's just enough to kind of open up the airway.
And this is a surgical procedure or a device or?
Yeah, so it looks like a pacemaker essentially. So we implant a device in your chest, and then we put an electrode on the nerve here. And then on the patient's end, they just get a remote where you basically just hit the green button, put it to your chest, and then Inspire will turn on after you fall asleep.
Okay.
So ideally, the patient won't know it's happening, but it should turn on when they have fallen asleep, and then it'll turn off before they wake up.
Is Inspire something that would be an alternative to CPAP, or do people need both? How does it work in the CPAP world?
Most people do fine with it, but if some people, they're claustrophobic, they just don't like wearing a mask, for a myriad of reasons. If they can't handle CPAP, then I would talk to them about Inspire. So basically, if you have tried other things and it doesn't work out, then we go Inspire, because at the end of the day, it's a surgery.
So I should tell you, I have sleep apnea, which you probably know. But yes, I have sleep apnea. I use a CPAP every night. And as I'm counseling patients about this, I talk with them about the fact that I have, plenty of room to roll over. It's not like, for whatever reason, I took to it very, very easily. But why do some patients, aside from claustrophobia, which of course is pretty common, but claustrophobia aside, why do some people have trouble with CPAP, and are there things we can do to help them with it?
So I could tell you every patient that comes into my office, when I show them a CPAP and then the masks, they always make a little face like, I don't know if I want to do that. I always tell them, everyone says that, and then when they start using CPAP, they feel so much better that they actually like using it. Some of my older patients, they can't live without it. So I think it's just something you get used to with time. Some people, claustrophobia is a big thing. Honestly, just having something on your face, it's a lifestyle change. You know, you're used to just feeling free and, you know, moving around while you're asleep and resting, but having something additional to do at night, you know, can be challenging.
I think the alternative is living a life of misery with sleep apnea, right?
Yeah.
Like, it's like, okay, I think patients don't realize the future potential they have in feeling great when they actually get a restful night of sleep.
Right.
Because you're not resting with sleep apnea, right?
Right.
So
Yeah, absolutely right.
Only time. I mean, how long do you tell patients to kind of work through that before they start to feel comfortable?
I would say at least give it a couple of weeks, and usually within a week or two, people feel more comfortable with it. And like you said, it's like day and night, the way they feel. A lot of patients have said, my family likes me a lot better. I'm a lot less irritable, and I don't, you know, those kind of things. Even like depression, it helps with that. Sleep apnea causes low testosterone, so usually when you treat your sleep apnea, your testosterone improves over time. So there's so many different ways that sleep apnea affects your body that it's, you know, good to get it treated, and you'll see the difference pretty quickly.
This is one of the episodes where we're talking about sleep, and I think people don't realize how important it is to get adequate quality sleep, and it affects every aspect of their life. So.
Right.
Well, and I think with that information about testosterone, every guy listening to this podcast who might have sleep apnea and said, I don't know if I want to be tested, the willingness might have just changed. You may have just shifted the paradigm for a whole host of people.
I always say I'm kind of like a marriage counselor, because there's couples that are sleeping in different rooms, and then we get them on CPAP, they're not snoring anymore, and now they're sleeping in the same room again.
All right, so I think we've established sleep apnea is important to diagnose, it's important to treat. There's a couple of different treatments, and we'll maybe revisit some of that. But for people who are thinking, either after hearing this episode or hearing their significant other, tell them, look, I keep having to smack you to get you to start breathing again in the middle of the night, maybe you should be tested. For all of those people, like, what is the first step? How should they go about seeking testing or starting to go down this path?
So talking to your primary care doctor about getting a sleep study would be the first step. Having your doctor put in a referral to sleep medicine is always a good second step. And then, getting a sleep study done, then, we'll read the study, see if you have sleep apnea, and then, get the ball rolling.
So a primary care doctor could potentially go ahead and order the sleep study?
Yeah.
Okay, good. I mean, we do that a lot in our clinic as well, although the neurology clinic and the sleep medicine clinic are reasonably closely aligned.
Right.
But I think that's really helpful too, to be able to get the study done, especially if it's a home study, figure out if there's anything to write home about, and then if there is, you take the next steps to go ahead and see a sleep medicine physician, get everything organized and...
Right, yeah. So it's... technically, any doctor can order a sleep study and then just put in a consult to us. So you'd be surprised the range of people that give us consults. So even like urology, if you're urinating a lot at night, that's caused by sleep apnea.
Oh, wow.
If you have like prostate issues, but you're still urinating a lot, then they'll put in a consult to us. Endocrinology will, because it messes with your diabetes and your, like we talked about, testosterone, different hormones too.
And you normally start with a home study then? Is that how it works? Or do you have to, because I remember I've had a sleep study done and I had to go spend the night and do an overnight study, which was not bad. Do most patients start at home or?
So the home study is fine in most cases, but if you have certain conditions, like you have underlying lung issues or certain heart issues like arrhythmias, like AFib and things like that, then you have to get a study in the lab, just because there's other types of sleep apnea, just other than the typical obstructive sleep apnea. There's something called central sleep apnea, where your brain tells your lungs not to breathe.
Okay.
So when you're at risk for that, then we'd want you to come into the lab.
Okay.
And aside from claustrophobia or maybe inability to tolerate the mask, are there other things that would make someone a good candidate in particular for Inspire or alternative treatments?
Yeah. So Inspire is generally a better option if your BMI is less than 35. It works a little bit better. Otherwise, CPAP is a better option. The other option is the oral appliance. So you would see a dentist for that, where they take a mold of your teeth and basically it's pushing your jaw forward while you're sleeping to kind of open up your airway.
Okay, so I mean there are some options there, but folks who are a little more slender might have a little bit more success with Inspire.
Mm-hmm.
Again, folks, of course, who have difficulty tolerating the CPAP mask itself. Maybe those who see their dentist and their dentist says, no, look, I don't know if this is a great idea for you. That's the kind of group that Inspire would really be helpful for. And is it, I know you mentioned putting a battery pack in and then running a lead to one of the nerves. And, that's the kind of procedure that's been around for a very, very, very long time. It's very, very safe. But what's the recovery like from that? Is this a big thing that's going to take someone out of their lives for a while?
The recovery time is really, you don't have to do too much. You just can't you can't be lifting too much or more than 50 pounds. But otherwise, there's really no restriction in your activity.
And that lifting restriction is short term?
Yeah, just for about 1 month until everything heals and gets settled.
I can go back and be a bodybuilder, is what you're saying.
I was hoping that would get me out of lugging the luggage back and forth.
I see.
I'm usually the family pack mule, and it would be great if I didn't have to, hoof all this stuff around.
So Gotham, what's one thing for our listeners that you want them to take away about sleep apnea today?
I think just it's important to get tested because it can affect your life in a lot of different ways. And one of the good things that I like about sleep medicine is it's kind of an instant fix, where the next time I see the patient, they're very happy. They're like, I feel fantastic. I should have done this years ago. So just taking the first steps and getting the ball rolling is important.
Well, outstanding.
Yeah. Well, thank you so much for being here. We've had a pleasure talking about sleep apnea.
That's it for today's episode of Your Brain, Your Health. Thank you for spending time with us, and we hope you're walking away today with a deeper understanding of the importance of sleep apnea, and how early recognition and treatment can have a major impact on your brain health and your overall health.
Your brain health matters, so keep learning and listening. If today's conversation helped you or might help someone you care about, please share it. And for more resources on your brain health, visit St. Luke's Neurosciences at sluhn.org. Until next time, take care of your brain and your health.